Hello guys, welcome to my channel Man at Anat. This is my first video and I am going to be teaching you brachial plexus. So understand one thing, the first diagram which I am going to use while I'll be making the diagram, the first diagram that I am going to use here is that diagram is a schematic diagram. Okay, that I will be making completely for the purpose of making you understand what is brachial plexus. So I'll advise you not to make that diagram in exam purposes. The diagram which you'll have to make for your exam purposes I will give you at the end. Now secondly, understand one thing, that why we should study brachial plexus. From exam point of view, it is very much important because from brachial plexus you can expect questions that are 2 marker, 6 marker, 10 marker. So you can directly expect that this kind of questions may be asked in your exams, and it is one of the most high yield topics because it is very much easy to understand. In 2 markers they will directly ask you just draw and label brachial plexus. Sometimes they even ask what branches arise from the posterior cord, what branches arise from the medial cord or lateral cord, what are the root values of the nerves written below. They will just simply ask you that, and this type of questions, trust me when I say this, these types of questions are very easy to attempt when you know what is brachial plexus. So without wasting further time, let's start with this. First of all, what is brachial plexus? If we go definition wise, then it is a plexus of nerve formed by anterior or ventral rami of C5, C6, C7, C8 and T1 spinal nerves. Okay, now one thing which you would have to understand here is what is anterior or ventral rami, because I have seen a lot of students just mugging up this word. Okay, that what is rami, they do not know it. Okay, so let's see that we have a cross section of spinal cord. Okay, so what arises from the spinal cord is this is a root. Okay, this is a cross section of spinal cord, and from this spinal cord two things arise, that is dorsal root of the spinal nerve and the ventral root of the spinal nerve. This both the roots converge and give us one nerve, one spinal nerve. Okay, let's supposedly say this is the dorsal root and this is the ventral root. Okay, then this may be your spinal nerve, and then this will divide and it will give you your rami. Okay, this will be your dorsal rami and this will be your ventral rami. Okay, so this ventral rami of the spinal nerves of C5, C6, C7, C8 and T1, this makes up your brachial plexus. Okay, clear with this? Now one should understand what are the components of brachial plexus. Okay, components of brachial plexus. Okay, so in brachial plexus we have 4 components. Okay, that would be your roots, trunks, divisions and cords. Okay, what are these things? You'll understand in a little while. Okay, but remember this one thing, that roots give rise to trunks give rise to divisions, and divisions form cords. Okay, now what are the roots here? That is the anterior rami of these nerves. Now, one thing which I forgot to tell you, that sometimes in MCQ they might ask this: if the contribution of the brachial plexus comes from C4, okay, generally it is not present, but if the contribution from the C4 is major, or if it is large, then then that brachial plexus is considered to be prefixed brachial plexus, and if it come from T2, then it is considered as post fixed brachial plexus. Okay, now I am going to be drawing a diagram which you would not have to draw it. It is completely for your understanding purpose. Please don't draw this diagram in your exams. Okay, see, these are your roots: C5, C6, C7, C8, T1. Okay, consider this as your roots. Okay, now what happens is ki this C5 and C6 merge and give us one thing. This is your trunk. C7 continues as whole and gives us one trunk, and this C8 and T1 also merge and give us one trunk. Okay, these are your roots and these are your trunks. Okay, now what could be their name? Their names are simple. This is upper trunk, this is middle trunk, and this is lower trunk. Okay, easy, simple. Now what happens is ki this upper trunk, this middle trunk, and this lower trunk, they divide. And what do they give rise to? Trunks divide and they give rise to divisions. Now what kind of divisions they would give rise to? This would be anterior division, posterior division, anterior division, posterior division, anterior division, posterior division. Okay, now the anterior division of upper trunk and middle trunk, they both converge. And they give rise to lateral cord. The anterior division of the middle cord continues as the medial cord, and the posterior division, the anterior division of the lower trunk gives rise to medial cord, and the posterior division of all three cords converge and they give rise to one single cord, which is the largest cord also, that is the posterior cord. Okay, so what happens? There are 5 roots for us. Okay, C5, C6, C7, C8 and T1. C5 and C6, they merge, they give us upper trunk. C7 continues as the middle trunk. C8 and T1 merge and they give us the lower trunk. Okay, from the upper trunk there are 2 divisions: anterior division, posterior division. From the middle trunk there are 2 divisions: anterior, posterior. And from the lower trunk there are 2 divisions, that is the anterior and posterior. Okay, this is anterior division, posterior division, and so on. Okay, now the last thing that you have to learn from this cords is ki what nerves arise from this brachial plexus, because nerves not only arise from these cords. Okay, you have to understand that thing, that nerves not only arises from these cords, this lateral cord, medial cord and the posterior cord, but they also do arise from the roots, they also do arise from the trunk, but no nerves arise from the divisions. Okay, so you can say that no nerves arise from the division. Now if they want to ask you a very simple question, or just for your understanding, if I may ask you a question, that what is the root value of this upper trunk? Easy, it is C5 and C6. What is the root value of middle trunk? Then you would easily say it is C7. What is the root value of lower trunk? It is C8 and T1. Okay, now one may ask you, what is the root value of lateral cord? Okay, so you may have to go backwards. Okay, that yes, lateral cord arises from the anterior division of upper trunk and anterior division of the middle trunk. Okay, lateral cord comes from upper trunk and middle trunk. Now upper trunk is C5 and C6 and middle trunk is C7. Then yes, the root values of lateral cord would be C5, C6, C7. Okay, similarly for the medial cord, you see, medial cord comes from lower trunk. Okay, then what would be its root value? Its root value would be C8 and T1. Okay, you see, posterior cord. From where does posterior cord arise? Posterior cord arises from the posterior division of all three trunks, that is upper, middle and lower. So upper is C5, C6, middle is C7, lower is C8 and T1. So this would mean that posterior cord has all the root values, that is C5, C6, C7, C8 and T1. Okay, understood? Once you understood this concept, the whole thing which I drew right now was to make you understand this whole concept, because once you understand this root values, then it would be very much easier for you to understand the root values of the nerves or the branches. Okay, now what you have to study is what are the nerves that are arising, because you understand that brachial plexus is going to control whole of our upper limb. Okay, so if you say of radial nerve, if you say axillary nerve, once you learn this nerves, the sensory supply of the upper limb would become easier for you. And trust me when I say this, when you go ahead, when you learn about the particular nerves, that would be the ulnar nerve, then there would be some other nerve. Okay, this concept of this sensory nerve supply would become very much easier for you once you learn this brachial plexus easily. Okay, so please pay attention to this, because for example, if in university, if God forbid, and you have not prepared one nerve, okay, and if it comes from 6 mark question, or it comes for 10 mark questions, so even if you just write its root value, I will guarantee you that they will give you either 1 mark or 2 mark. Okay, and I would say that is better than nothing. Okay, so just please pay attention to this. Okay, now we have to understand the nerves. Okay, now understand this, the part which required your understanding is over. Now you just simply have to mug up the name of the nerves. Okay, the part which required your understanding is now over. You just now have to simply mug up, and please don't draw this diagram in your exam. Okay, please don't draw this in exam. I will give you the diagram at the end, draw that in the exam, but please don't draw this in exam, because I drew this in my exam and my professor or my faculty gave me 0 marks. But yes, it is easy for the understanding purposes. Okay, so nerves. Now remember, from where does nerve come from? I told you that initially, that nerves arise from roots, trunks. Do they arise from divisions? No, they do not. They do not arise from division and from cords. Okay, they arise from this. So we have 2 nerves that arises from the roots. Okay, what are those nerves? Okay, understand this. We have two nerves that arises from the roots. Okay, the first nerve is long thoracic nerve of Bell, and the second is dorsal scapular nerve. Okay, these two nerves arises from the roots. Okay, so where do they arise? Let's go just back to this diagram. Okay, just focus on the roots portion. Okay, so this is your long thoracic nerve of Bell. Okay, it comes from C5, it gets its contribution from C6, and it also gets its contribution from the C7. Okay, so it comes from three roots, that is C5, C6 and C7. Okay, so if one may ask, then what is the root value of long thoracic nerve of Bell, then you can easily say that it is C5, C6 and C7. What about the dorsal scapular nerve? Dorsal scapular nerve comes from only one root, that this is this C5. This is dorsal scapular nerve. Okay, so dorsal scapular nerve arise from C5 only. Okay, now there are two nerves that arise from the upper trunk. Okay, just pay attention here. Yes, these are the two nerves that arise from the upper trunk. What are the name of these two nerves? Nerve from trunk, and there are only two nerves that is coming from the upper trunk. Okay, those nerves are suprascapular nerve and nerve to subclavius. Now what is subclavius? Subclavius is a muscle. Okay, now one might ask that what is the root value? See, from where does it arise? It arises from the upper trunk. Okay, then what is the root value of upper trunk? It is C5, C6. Then what would be the root value of these two nerves? You guessed it correctly. Yes, it is going to be C5, C6. Again C5, C6. Okay, so these are the nerves. Okay, now this point, okay, this point, you can see that there are 6 nerves here. Okay, that there are roots of C5, C6, and there are two nerves that are arising from here, that I told you already. Okay, these two nerves are also arising, and these two divisions, anterior division and posterior division. Okay, we can see this much thing. Okay, so this point where there are 6 nerves, okay, root of C5, root of C6, these two nerves and two divisions, that is anterior division and posterior division, this point is considered to be as the Erb's point. Okay, now the nerves that are arising from the, and remember this Erb's point. Okay, Erb's point is important from clinical point of view. Okay, it is a point where 6 nerves meet. Okay, I will be covering this Erb's point and Erb's palsy in the next lecture, the clinical anatomy related to the brachial plexus. Okay, now the nerve arising from the cords. Okay, so first go with the lateral cord. Okay, remember one simple mnemonic, that is LML. Okay, what does LML give us? It gives us lateral pectoral nerve, it gives us lateral root of median nerve, and it gives us musculocutaneous nerve. Okay, now one might ask what are the root value of these three nerves, but we know that a lateral cord arises from the C5, C6, C7. How do we know this? Because we know that lateral cord arises from the anterior division of upper trunk and middle trunk. If we know that, then we know that these three nerves of the lateral cord also arise from this nerve root only, that this is C5, C6 and C7. Okay, Easy. Second comes medial cord. For medial cord, you have to remember one mnemonic, that is M4U. Okay, before going further, do we remember what is the root value of medial cord? Where does medial cord come from? Medial cord comes from the anterior division of the lower trunk. Okay, anterior division of the lower trunk. So lower trunk is C8 and T1. So the nerves which are arising from the medial cord would also have the root value of C8 and T1, but there is one exception which I'll be telling you. Okay, see for this one thing. Okay, we have lateral pectoral now. This might from this you can understand then there might be one medial pectoral now also. Okay, so yes, there is medial pectoral now also, which comes here. We have lateral root of median now, so one might also say we would have median root of median now also. So yes, we have it here. We have medial root of median now. And this is the only nerve, median nerve, which has two roots. You see, this lateral root and this median root. Okay, so when one asks you what is the root value of median nerve, not the medial root of median nerve, not the lateral root of median nerve, when one asks you what is the root value of median nerve only, so you would have to think that yes, there are two roots. Okay, there is one lateral root, there is one medial root. Lateral root arises from the C5, C6, C7. Medial root arises from the C8, T1. So okay, then median nerve, only median nerve arises from C5, C6, C7, C8 and T1. Okay, clear? Then done with this, now we have medial cutaneous nerve of arm. Okay, if we have arm, then there is surety, then we would also have medial cutaneous nerve of forearm. Okay, and the root value of all these nerves is only one, that is C8 and T1. But I told you that there is one exception, and that exception is in the U, that is ulnar nerve. Okay, in ulnar nerve the root values are a slight difference, there is C7, C8 and T1. Okay, done with this. Now the last root that is remaining is last cord that is remaining is posterior cord, and the biggest cord of all in terms of its thickness, I am saying. Okay, one might ask you this question, like our professor just asked in the dissection hall, okay, do you know why we have given these names, that posterior cord, medial cord and lateral cord? So these are things that we give in one's reference, that this is posterior to this is lateral to this is medial to this. So we have given these cords, we have given these trunks, upper, middle and lower, but from what reference we have given these terms? So we have given these terms with reference to the axillary artery. Not important from the exam's point of view, but yes, it's a fun fact that you could remember. Okay, now what is the posterior cord? Posterior cord, we saw that posterior cord arises from all the nerve roots. Okay, it comes from all posterior division. Okay, all the posterior division. Okay, so posterior cord has all C5, C6, C7, C8 and T1. Okay, now the mnemonic that you have to remember for posterior cord is ulnar. Okay, it goes like upper subscapular from U, lower subscapular, okay, then N is nerve to latissimus dorsi. Again, latissimus dorsi is a muscle. Then A is for axillary nerve, and last it is radial nerve for R. Now remember this, the root value of these nerves are not as simple as these nerves, that you would have simple C8 T1. Yes, these nerves are arising from the lateral cord, then they would be C5 C6 C7. These nerves are arising from the medial cord, they would have the root value of C8 T1. It is not that simple with the posterior cord, okay? But you know that it arises from all the root values, that is C5 C6 C7 C8 T1, okay? So if you remember this mnemonic, then remember this nerve's root value as this only, okay? Upper subscapular, lower subscapular, okay? C5 C6, again C5 C6. Now skip one nerve and one root also, okay? Skip the nerve to latissimus dorsi, okay? Then we would have C6 C7 and C8. For axillary nerve, skip one nerve, then we would have C5 and C6, and go back and skip one root value. First skip one nerve and continue with C5 C6, then go back and skip one root value and go with C6 C7 and one also, that is C8. And the last that is remaining, the radial nerve, it is the biggest nerve. It is one of the most prominent nerve that you will see in the dissection, and it has all the root values, that is C5 C6 C7 C8 T1. You can make any mnemonic that you want, but I remembered in these terms. Okay, first nerve C5 C6, second nerve C5 C6, skip the third one, axillary nerve C5 C6, okay? Now go back. Now I am done with C5 C6, okay? I am done with C5, okay? Let's leave C5. Then I will go C6 C7 C8, okay? Now last radial nerve is remaining. Radial nerve, biggest nerve, it would have all the root values, okay? C5 C6 C7 C8 and T1, okay? So that is the way that I remembered it, okay? So I would say yes, that is it, okay? In the first part I have covered all this, okay? And the last and the foremost important thing, that how will you draw, because the question that is asked generally in exam is key draw and, okay? So from exam point of view, when they ask you to draw and label brachial plexus, if they ask you in 6 marks short note or in 10 marks short note, then do not go with this particular diagram. Go with the diagram which I am giving you right now, okay? First draw these 3 lines, okay? Give them roots. This is your roots. This is C5 C6 C7, okay? There is no root here. Then there is C8 and this is T1, okay? Now I told you initially that yes, these are your roots. I told you initially that nerves also arise from the roots. So yes, this is one nerve that is arising from your root. It arises from C5, it also arises from C6, and it is also coming from C7. What nerve this could be? This is long thoracic nerve of Bell, okay? Another root also arises from the C5. What is that? That nerve is dorsal scapular nerve, okay? Now from roots we move off to trunks, okay? So yes, this would be your upper trunk, this would be your middle trunk, this would be your lower trunk, okay? This is your upper trunk, this is your middle trunk, this would be your lower trunk. And yes, 2 nerves do arise from the upper trunk, that is nerve to subclavius and suprascapular nerve, okay? Now comes your division portion. This is your division portion. Draw something like this, okay? So this would be your division portion, and I told you in the beginning that no nerves arise from the divisions, okay? Now just simply for the purpose of mugging up, what I used to do is like 3 nerves comes from here, 3 nerves come from here, and 1 nerve come from here, okay? And I used to remember, yes, that there is median nerve which has 2 roots, okay? 1 root come from the lateral and 1 root come from the medial cord, okay? So this must be my median nerve, okay? And this is the nerve which I am darkening right now. This nerve would also divide, okay? And this nerve would also continue, Okay, what nerves are this? Okay, this is musculocutaneous nerve, which I'm saying MSCN, musculocutaneous nerve. Okay, this is coming from my lateral cord. Musculocutaneous nerve was all, of course, in my lateral cord. So this is the lateral root of median nerve. This must be my medial root of median nerve. So what this must be? This is my median nerve. Okay, so lateral root arises from the lateral cord. So the continuation of lateral cord in our upper limb is musculocutaneous. Now they might ask you this, okay, if your viva is going well enough, then they might ask you this, that what is the continuation of lateral cord. So you have to say that it is musculocutaneous. Now they might ask you what is the continuation of medial cord. This is your medial cord. What is the continuation of medial cord? So yes, this nerve is the continuation, and this is your ulnar nerve. They might ask you what is the continuation of posterior cord. It is none other than radial nerve. This is your radial nerve. Okay, and another nerve that is present along with this, it is the axillary nerve. Okay, so these are your major nerve. Now just mark this off, that this is upper subscapular, this is lower subscapular, this is thoracoid, this is upper subscapular, this is lower subscapular, this is your thoracodorsal, this is your lateral pectoral nerve. Okay, this is your medial pectoral nerve, this is your medial cutaneous nerve of arm, this is your medial cutaneous nerve of forearm. Okay, just simply mark this diagram off. Okay, and trust me when I say this, if you do it for like 3 times, 4 times, or 5 times, or even 6, 7 times, okay, it would not take you more than half an hour. But once you mastered this diagram, consider this, that yes, one question is always going to come from the brachial plexus topic, not from this, then from the clinical portion. But even if they ask you like simply write the clinical applications of the brachial plexus, and even if you just draw this diagram, they would just give you 2 or 3 marks. Okay, so this diagram from the exam point of view, I would consider it as the most important. Okay, and initially what I have tried to make you understand things. Okay, try to understand things. If not possible, then it is anatomy, just mug it off. Okay, but I tried that I could make it as simple as possible. And please, if possible, please, I am requesting you, please, if possible, then don't mug it off. Just you have to mug off the names though, but don't mug it off, just try to understand it. Okay, and in the next part, I am gonna, in the brachial plexus part 2, I will try to cover off its clinical portion. That would be Erb's palsy. There would be your Horner syndrome too, because Horner syndrome, sometimes I have seen some colleges ask this in upper limbs part ending exams, though it belongs to the head and neck portion, but they do ask it. Okay, but they only ask it in 2-marker question, that what is Horner syndrome, what are the symptoms that are seen in Horner syndrome. Okay, and the Klumpke's paralysis. Okay, in the brachial plexus part 2, I am going to cover its clinical or applied portion. So till then, please master of this portion, because this portion, if brachial plexus is cleared off right now in your dissection table, if brachial plexus is cleared off from the fat from their portion, then first see this topic and go to your dissection hall and try to identify the nerves. Okay, the nerves we generally try to identify it from the axillary artery, and from the axillary artery we try to identify the median nerve, that we see that there is a Y. Okay, so try to pay attention in your dissection hall, because we didn't used to give attention in our dissection hall, and that cost us something, not marks, but yes, that cost us our respect in front of our faculties in vivas also, because in vivas we were not able to identify it. So thank you from studying from me, and if you like this, try to tell your friends to study from me. Thank you. Not this.